So of course I can't go specifically into
No, no.
detail, but I absolutely have lots of patients who are federal workers. And there's lots of despair, lots of stress, worry, anxiety, just lots of general concern about, will I be able to pay my mortgage? Will I be able to buy groceries? What's going to happen with my family or my pets? So there are a lot of people that are worried day to day and waiting for these arbitrary deadlines of, okay, on this day, will we hear this layoff or will we get this uncertain email? That is, determining our future. And I think that it's also impacting people's sense of purpose. So, to your point earlier, people have invested decades, years into their roles in the federal government, which we historically have considered to be the safe, jobs. And so now to be faced with uncertainty and just an unexpected um, loss of that role, it's a trauma, to say the least. And so I think there are a lot of people, especially in this area, that are in crisis because of that.
We know we have thousands already here in Montgomery County that have been impacted directly by the layoffs, but our focus really is on ensuring that people are aware of what to look out for, self-care, that they can connect even with their primary provider around any signs of distress or mental health. There's a lot of preventive, proactive strategies that can be used, even if they're in the throes of right now, oh my goodness, what is my next step? I know I need to look for my job, even if that's their focus. Just recognizing the stress that they're undergoing as a result of these really sudden terminations and the way that they have been also implemented adds additional distress.
So I think initially it's important to remind people that, we're human. And so our emotions are communicating to us how we're doing. And so anger, sadness, uncertainty, anxiety, all of those things make us human and our natural responses to what's happening. And so I just try to help people sit with the emotion before trying to go into fix it mode or before trying to figure out, what big decisions to make because it's also hard to make decisions when stressed. So really it's just that fine timing and space of sit with yourself, let's just be human for a second, and then we'll take things in very small steps, respective to a person's situation. And so unless, there's a specific crisis that requires a 24-hour response of some sort, which is rare, but not, uncertain or not impossible, just sit still for a second, but let's just find our breath. Let's just normalize and name what we're feeling. And then we'll get in community. We'll, figure out a plan and knock out whatever needs to happen after just finding our breath first.
I have found in the work that I've done and with all of my colleagues that the most difficult thing to navigate is injustice. When someone feels like something has happened to them that is not fair, it is the most difficult thing to navigate. And what happens is people stay in a space of ruminating about it and going in circles of this is not fair, this is not okay, it shouldn't be this way. And it's going to sound awful, but it's a true statement. Fair is something that the counties run, right? Fair is not the way this life is often. And the sooner that we get to a place of, I'm going to call it radical acceptance because that's the name of this skill, but it's really, if that word bothers you, you could change it to radical acknowledgement, acknowledging the fact that this is reality right now. It is what it is. I don't like it. And this is reality right now. When we get to that point, then we're able to start making those baby steps towards what's next. If we stay in the space of this is not okay, this is not fair, it shouldn't be this way, we're staying in a fight with ourselves. And it's going to prevent us from starting to make the new first steps. So getting to that place of radical acceptance and knowing even if we radically accept something for 5 minutes, when there's injustice involved, it's going to circle back around and around and around where you went to a place and you're like, yeah, this is okay. I'm going to look for something else. And there's going to be this other opportunity. And then all of a sudden, 2 hours later, you're back to where you were. This isn't fair. This isn't okay. And there are all kinds of skills. We have a free video library with all of these skills, totally free for anybody. to go and jump on and start learning the skills, and we'll navigate, email us, we'll tell you which skills to watch, and it's all for free. But really getting to a place of understanding, I don't like it, and this is the reality right now.
The manner in which these layoffs were conducted really does exacerbate the distress that goes along with them. Discovering that your employment status, what that is today through a badge scan as you show up to work, as opposed to a formal meeting or even a formal communication that centers human dignity, can lead to different feelings of humiliation and insecurity, right? Another layer on top of just the impact of the security, of having lost that security of the job. So it's important to know that mass layoffs in particular, as opposed to one-offs, can have severe and lasting effects on your mental health. So look for those signs of increased anxiety. For some people, they feel that in their body and through physical symptoms. Don't ignore new physical symptoms. They could be absolutely physical symptoms. They could be signs of increased mental health distress that need to be taken care of through a combined and integrated approach with your primary doctor and or behavioral health provider. There's an increased risk of depression and even suicide. Absolutely. The uncertainty surrounding your future employment prospects and your financial stability really can intensify those issues. And then for those that are not laid off and still reporting to the office or to their workstation in the midst of all of this, we need to also ensure that we are aware that all of these reductions also lead to a mental health crisis among the remaining employees. They can lead to that. They're experiencing obviously increased workloads, job insecurity because they don't know when their last day is going to be, and diminished morale as well, which is, there's no way that doesn't lead to decreased productivity and heightened stress levels as well. So whether you're on work status today or not on work status today, but working in the federal sector, this message is really for all of you to know that in Montgomery County, we are here for you. As a chief of behavioral health and crisis services, I want to make sure that you're aware that we have a 24-hour crisis center here in Montgomery County. You can walk into it at 1301 Picard Drive in Rockville. You can call 240-777-4000 any time of day. We also have our partners that are operating our 24-hour 988 mental health distress and suicide support line. So for those of you that are overcome all of a sudden and are not able to attend to those initial symptoms that you're experiencing that kind of mental health distress and increased anxiety or depression, and it becomes overwhelming all of a sudden, please come to us. Please reach out. You're not alone. And we'll make sure to provide the support and the care and connections that you need.
I know that some of us have sort of resonated with it feeling like COVID again, if you will, because of this massive trauma that is not in people's control, and in some ways worse, because it really, really, really is impacting your livelihood. There was a sense of control, if you will. If you stayed in your house and you were safe during COVID and washed your hands, you could have some element of control, but there's just no way that you can control whether or not you get laid off or, whatever unfortunate circumstance might be. So definitely on the professional side for mental health folks here in the area, it's felt like another community trauma that's really keeping us busy, if you will.